So I'd like to do some initial introductions. Edna Niamu is the OHA Healthcare Interpretive Program Manager at OHA, and that's part of the Equity and Inclusion Division. Hello, Edna. And Nathan Roberts is the OHA Medicaid Program Manager at Oregon Health Authority's Medicaid Program. He's one of the managers that oversees the policy for the Oregon Health Plan. And David Simnett, he's the principal at DS Consulting, and he has more than 20 years of program and policy development experience. And so welcome, everybody, and thank you again for taking the time. It's extraordinarily busy time of the year with legislature in session. And I'm going to start with you, Edna, because we have spoken in the past. Can you please provide a little bit of background for everybody online here about the need for interpretive services? And just a little bit of history now that it's mandated and you have to go through OHA and the Certified Interpreters Program, but maybe you can provide a glimpse into where we were prior to and where we are now.
Yes, good morning, everyone. Thank you for the time to give us to join the meeting. So it sounds like it's a new rule or new law, but really it's not something that is new. It has been there in the past. I think what is now, it's more the reinforcement. But the requirements to work with healthcare interpreters who are trained, that is something that has always been there. It is required. Now there is a reinforcement. So we know that for a long time, people have been working with healthcare interpreters, and some of those who are not trained, and that's taking risk for the patient and for interpreters as well. So if you are having a patient and you're working with interpreters, of course, their cost is low, and that's why probably some other providers who are working with them, because they're easier to get, they'll take whatever the cost that they can be given, because that's not, they do not go through the training. So the new law, the House Bill 2359 that was passed 2021, and then last year became effective July 1st, that all healthcare providers, CCOs included, have to work with interpreters who have gone through the training. They take 60 hours training. They have other requirements that are required by OHA. They need to send their complete application to OHA. We review them. Then they will go to the list. It's called Healthcare Interpreter Central Registry. That their names will be there. You can look at that registry. You can find the county where the interpreters are coming from, which language they speak. You can get their full name, their contact is there. So really at the beginning, it was like an issue. How can we find healthcare interpreters? Right now, we have over 1,300 and something healthcare interpreters on the registry. So it can be issues for some languages, because languages of lesser diffusion in some locations, but really you can easily type the language, who you are looking for, which county, and then be able to find interpreters. So that is not like an issue now, at least at the beginning. It was like, can we really be able to provide healthcare interpreters? And it's very important to have interpreters who went through the training. You know, you're working with interpreters on site or through remotely, but they went through the training. They are doing the medical interpretation, different from community interpreters. I do that as a community interpreter myself. But until I went through the training, medical terminology, they are very important. You can go wrong, it can be life and death for some, for a patient. And that's why it's really required to work with interpreters from the OHA registry. And those interpreters also went through the training that is approved by OHA. So it's not like a new rule, it has been there, now there's enforcement. There are some situations where you might not be able to find healthcare interpreters trained from the registry, and we're not saying stop providing the care. You have to provide the care, but document the steps that you went through, that you're going to find this interpreter for this language, you had to do this and that. So it is something that, we still have to work on it together and make sure, yes, we provide interpreters, but maybe the patient declined and wanted something else. Document those processes, because it will be required or upon request by OHA to provide that. So that's like a big picture of why we need to work with interpreters.
Well, thank you very much for that. Now, when you mentioned the fact, hey, we've really tried to find somebody, we couldn't in this case. Are there forms online for record keeping that our doctors can use to document that?
Right now, we don't. So we are leaving that for providers to have their own template or the way of putting the documents for the time being.
Well, I think that some people would actually be very happy about that, the ability just to make some notes. Nathan, turning to you, can you describe, please, a little bit about what your job entails?
Yeah, happy to do that. I work for the Oregon Health Authority in Health Systems Division, and I'm with the Medicaid program, the Medicaid policy team. We're the group that's responsible for the operating sorry, the Oregon Health Plan. You are probably well aware that the Oregon Health Plan is mostly operated through contracts that we hold with coordinated care organizations. So about 90% of the 1.4 million people who have Oregon Health Plan as their insurance receive that through a CCO or coordinated care organization. And then about 10% roughly, the state is the direct payer for the services. And so I'm on the team that's a little bit more focused on the when the state is the payer. You hear that group referred to as open card or as fee for service. However, work very closely with the CCO contract and compliance team that oversees the work done by the CCOs as well. The covered benefit and many of the standards are going to be the same across the CCOs and the state as a payer for health plan. Some of the details of what a CCO might want to see on a medical claim and how the payment gets made and perhaps authorization steps might be different from CCO to CCO or for the CCO or for the fee-for-service program. Just the nature of those contracts, as long as CCOs are reasonable, they do have some flexibilities to design some of those details. Rates as well, you'll see some variation in rates across those payers. So most of my job is the policy for the fee-for-service program. Also, we serve as sort of the subject matter experts to help the contracts and compliance team that oversees the work of the CCOs. When they need an expert on vision care or on hospitals or dental, right? That our team has those policy folks. So that's what I do.
Well, it's great to know that you're in that position. On a separate topic for another day, we have reimbursement issues that a lot of our doctors are experiencing on different CPT codes, but that is another topic for another day. Today, we're talking about interpretive services. And David, would you like to talk a little bit about your background?
Yeah, you bet. I am working as a consultant with the Oregon Health Authority and specifically with the healthcare interpreting program. I was brought on back in 2011, shortly after the House Bill 2359 was passed, to help with sort of implementation and develop policy development and decision making around sort of taking what was spelled out in the law and translating that into sort of workable language for the administrative roles. So helped with that process, and also there are a couple of studies that were requested by the legislature that I helped put together. So, and I'm currently working sort of in the implementation phase now with the authority and sort of looking at monitoring and seeing how things are going.
Well, thank you. We've got a great team of experts here, and I want to get right to some questions that were pre-submitted. One of them, please feel free, audience, to put into the chat room any questions that you have that you want to make sure that we cover before the end of the session. The question, first of all, is can we get reimbursed for over-the-phone interpreter services when scheduling appointments and answering eye health related questions?
So I'm able to speak for the Oregon Health Plan, of course. I just want to be clear. I can't speak for commercial or other payers, but the Oregon Health Plan doesn't have a different or lesser reimbursement for in-person interpretation or telehealth interpretation. Those are both eligible. Again, the details of how the payment looks will vary, whether you're being paid by a CCO, the member is enrolled in a CCO, or the fee-for-service open card program. In the fee-for-service open card program, any interpretation tele included would be eligible to bill with the CPT code T1013, and it's a $60 flat fee. There isn't yeah. So that's how it would work if the state is the payer for about 10% of the Oregon Health Plan. The details of how that would work, you would have to look to each CCO to see how that might reimburse, but as a general, but all of them would have to have a pathway to payment for interpreter services. That's part of the covered benefit. So,
Well, thank you. I've got another question here, but I'd just like to ask you collectively, what are some of the problems that have been common for people trying to secure interpreters, and what are some of the solutions? I'm asking you to just, because this is obviously a wide open question. You must have a range of people who are challenged in one way or another. Is there one thing that you can recommend for our practitioners? We have 700 members across the state of Oregon. And our doctors of optometry are located in rural areas and urban areas, just like everybody else in the state. But sometimes there are access problems. And so are there any specific things that you think can help right out of the gate for our doctors of optometry to know that might help them navigate the system?
I can start and maybe my colleagues can help. I think so far what we are hearing as issue is for the languages of lesser diffusion, the languages that are not as common in rural areas, that they're having hard time finding healthcare interpreters. So the quick solution is not very quick, but we're trying to look at demographic where the population is going for example, Afghan, Ukrainians, and Central Republic of Congolese. If they're sent to those refugees or immigrants sent to Eastern Oregon, then we're providing training specific for those areas. So looking at where interpreters are needed, which language is needed, and then just provide the training so we can have qualified or certified healthcare interpreters. It's not a quick solution, but that's one of the issues that we are hearing according to location and the availability of interpreters.
Thank you. Anything else to add, Nathan or David, to that end? Things that you have observed as just being a common question that can be answered for our docs? If not, I've got a couple of other ones here.
David, do you have anything? I have. I would only say that I know that the Medicaid program needs to work in this area. When I look at the amount of billing that we're receiving for that T1013 code compared to what I expect, how many members I expect would need that service, we aren't being billed for it. So something is not working for providers because they're not that $60 reimbursement no one's taking advantage of that. So very few are. So I don't have a quick, let me give you some tips for how to make things better, but I do want to acknowledge that at least by that metric, it isn't working as well as we need it to.
Well, hopefully that awareness and the fact that there is that reimbursement rate out there is going to be very, very helpful.
Yeah.
Second question, can we get reimbursed for optical visits that need interpreting services? Many times the interpreter scheduled for a visit doesn't have the time to stay to help with the frame selections after the exam. Can we get reimbursed if the second appointment happens on the same day?
That would be Nathan.
So that's probably one for us to take back and take a good look at. Right now, the fee for service program, again, about that 10% of Oregonians where their Oregon Health Plan is billed directly to the state. We wouldn't allow the same patient, same CPT code. I believe those would be, the rendering provider would show up as the same. So all those details on the claim would be the same. And so it would deny as a duplicate. So that's something we might want to take a look at for ophthalmologists particularly. And then for the CCOs, that would have to be a question asked for each of them, and you might find some variation in, some of them may have decided to resolve that issue, and some might be where the state is without a resolution. So,
Well, thank you.
I think if I can add to that,
Please.
If you're scheduling an appointment with healthcare interpreter, there is a time, if you say it's from 8 to 10, interpreter will be there for those hours that you want them to be there. But then if it's a cutoff, like there is a place you don't need an interpreter, then they have to go and then come back, then that's just complicate the issue. But it depends how many hours you can let the interpreter know, I need you from this time to that time. Then they'll have that in their schedule. So I don't know how, if you schedule the appointment and then you have to let the interpreter go and then you have to bring them back again, then yes, there'll be all those payments.
Well, that's great. One question that I don't have written down, but I have heard from members is, what happens if an interpreter is hired for a visitation and the patient does not show up for their appointment? We're finding that some of our doctors of optometry are on the hook for that payment, and already the reimbursement rates for a lot of these visits are unacceptable. So are there any clauses, any provisions that would provide for that to be waived or picked up by another resource?
If there's an interpreter being scheduled for a certain time and then the patient does not show up, interpreters still have to be paid. That is just, it's required that way. And I think there is a minimum hours, I think at least 2 hours minimum. Some organizations, some language service companies, they require, because some providers, they go through the language service company, they don't go direct to the interpreters, so they contract with interpreters through language service companies. And then there's a requirement, either 2 hours minimum. If the patient does not show up, interpreters still have to be paid. I don't know.
Yeah, so I can speak about that. So this will sound a little bit ludicrous, but because we all know that the Medicaid reimbursement rates are low. But the sort of the technical way that we view that is the compensation for no-show visits is supposed to be sort of amortized into the reimbursement for the visits that do show up. So there isn't a space for a separate reimbursement for no-show visits. So that is probably also an issue that we need to take up and look at. I don't know that that the rules that govern how we can use federal money, Medicaid's about 60 in Oregon is about 60% federal and about 40% state, will allow us to pay for no-shows. So a solution would be to look at, when we did the math that resulted in that very low dollar amount, did we adequately consider the no-shows and include enough to cover that known expense? Probably not, but yeah, that's sort of how the state of it stands. The CCO contractors do have a little bit more flexibility with the federal money. I doubt if any of them are paying for no-show visits, but you could see some variation in that regard as well.
Thank you. We have a question from Jessica Teagan. She is an OD in Madras. He says, our staff is all bilingual because we serve a population that is 1/3 Hispanic. We have found that our patients prefer our in-house staff because they are more skilled at eye care discussions and testing than certified interpreters. We're looking to get our staff certified, but there are no trainings in Central Oregon. I'm going to just try to scroll down here and see that whole message. But there are no trainings in Central Oregon. I don't know if there's more to that question. I just can't see. Oh, here we go. And it is a huge financial hardship and a hardship for staff to be away from work. Do you have suggestions for our office getting our current staff certified?
Yes, so and other providers have done the same. They already had their own in-house healthcare interpreters, but they did not go through the training and they needed to be on the registry. So they provided the training for them. I think All Care, CCO All Care, they do that. They provide training in Southern Oregon for their healthcare interpreters. So I know, yes, it takes time because the 60-hour training is not like 1 day training, and some organizations that provide the training, they look at the community and say which one, what schedule is better for them. There are some who prefer take full day and then it's shorter, or make it longer but take few hours here and there. So I cannot control how that schedule will work. Yes, some hours will be taken away from work to be able to take the training, but the training is necessary for them to be on the registry so that you can be able to document that you're working with interpreters who went through the training. Yes, if they're in-house, perfect. They just need to get the training from OHA approved training. And there are a number of those trainings that they are willing sometimes to do. They are probably located in metro area, but they can do online training in Eastern Oregon. They've done that before. So it's just how can you coordinate the training and then availability for your in-house healthcare interpreters.
Okay.
And this is Nathan. We are working on dipping our toe into a small reimbursement enhancement when a bilingual provider certified uses their skills in that way. Right now, we're rolling that out with in our behavioral health arena, but we are looking at being able to expand so that when a certified bilingual provider serves a member, they're able to have a slight reimbursement bump. Again, that's on the fee-for-service program, and I don't know if any CCOs have gone ahead of us on that. It's the kind of thing that it's not uncommon that CCOs follow and do something similar once the fee-for-service program takes that up. So that's just at its beginning stages right now, working towards it.
Thank you. I've got a question. Hi there. I haven't been able to get a clear answer. Does this requirement apply to Medicaid patients only, or does it encompass commercial payers as well? Or are you unable to answer because you're just focused on OHA and Medicaid?
Edna or David, do you know? I don't actually know the answer to that one.
Yeah, I can take that one, Edna, if you want me to. So what the statute says is that for providers who accept public payment, then they're required to abide by the law and these rules. And so what that means is that as a provider, if you are serving Medicaid participants or Medicare participants where you've got federal public dollars coming in, you're serving somebody where like the county is the payer, then that would also be public dollars. So as soon as the office or that particular provider is accepting public dollars, then they are subject to working with certified or qualified healthcare interpreters from the registry for all of the services that they provide to people who don't speak English. So it wouldn't just be the Medicaid participant that's in front of you at the particular moment because Medicaid is paying, it would apply across the board.
Thank you for that reminder. I assume that the vast majority of our practitioners are accepting federal dollars for Medicaid and Medicare. That's very helpful. Thank you. MVS is saying, thank you. It didn't look like any of the local trainings were approved by the OHA. So I can't really address that one. Hopefully we can work through the system and make sure that there are qualified trainings for just every part of the state.
Yeah, I can share the link to the OHA website, where you'll be able to see a list of OHA approved training organizations that you can contact them and see when they can provide the training.
That would be tremendous. Thank you. That'd be very, very helpful. I'll make sure that that gets recorded and shared as well for after use. This comes from Janelle. We've never had to hire an interpreter as of yet. Do we pay the interpreter services directly?
So again, I can speak for the open card or free for service when a member's insurance is paid by the state, or their Oregon Health Plan is paid by the state. Yes, the clinic would pay an interpreter service usually, or perhaps pay an independent interpreter directly. The reimbursement from our program is considered a practice expense. We're recognizing that you have this additional expense, and so we're paying $60 to help offset that a little bit. Some of the CCOs might handle that differently. Some might have a contract with an interpreter agency, a service, and then you would just use that service and you wouldn't incur an expense. I don't think that's super common, but you might see some variation across the CCOs. So you will want to check with the CCOs where the patients you're serving come from. But at least for the open card program, you would incur this expense. You would pay that directly and then bill us for a small amount of reimbursement.
There is a comment from Gabby that says Care Oregon is currently covering OHCIA's interpreter training and financial assistance for employees that work in any healthcare system. The training is online via Zoom on Thursdays or Saturdays, and it lasts 8 weeks. A requirement for approval is that your employer works directly with Care Oregon patients, and you can contact Renee Chavez, the case manager at Oregon Healthcare Interpreters Association. And she left an email address of r.chavez@ohcia.org, and that is in your notes. And then thank you very much, Edna, for providing that link to the Oregon OHA interpretive services. And there's someone that says, I understand that some of the interpreting services can bill OHP directly. And I think that you've covered that a little bit, Nathan. Am I right?
I think so. Yeah, it's going to depend on who is the payer, a CCO or the state, based on the members' OHP enrollment, right? So looking up to see if they have OHP, and then who is the OHP payer. Is it a CCO or is it the state directly, to figure that out?
All right, well, thank you. And this is kind of a follow-up to another question that we had a little bit earlier. Our language service providers often can't facilitate qualified interpreters or cancel last minute. Can we use a bilingual, non-certified staff member or student to do the interpreting and still get reimbursed?
So I think Edna covered the due diligence, right, to make attempts and document that you weren't able to get a certified interpreter. The reimbursement, I think I'm going to have to get back to you. I'm pretty sure that we are not able to reimburse if there wasn't a certified interpreter, but yeah, I think I'm going to have to follow up and get back to you on that one.
Right, thank you.
So I'll take a note.
Oh, here's a question. If we haven't been billing, can we backdate 120 days on this?
You for the state, you've got you have a year. We can for a initial submission of a claim for the open card members. I can't remember if we allow quite that much on the CCO side, but there is a backdate window. So check with your CCO on how long that is. But for the state, it's a full year for an initial claim.
Here's a question that was pre-submitted. Best practices for billing interpreters when using qualified interpreters that are employees. Would you like me to repeat that? Any best practices that you recommend for billing interpreters when using the qualified interpreters that are also employees?
For the state, that wouldn't change the billing. The requirement is that you're using a qualified or certified interpreter, and then you bill on that patient's claim for the practice expense. So the interpreters, the Medicaid, or the interpreter doesn't show up on the claim. It's the practitioner that incurred the expense. But if your expense was paying someone's salary, or it was paying a language service agency, that doesn't change the picture for the open card program anyway.
Well, thank you. Another question is, what is the Care Oregon reimbursement amount, and can we bill per hour or per service? Is DMAP reimbursing for these services too? And what about Pacific Source?
So DMAP is another term for the open card or fee for service. When you're billing the state directly. For the state, it's a per service. There isn't we don't increase the rate for more hours or decrease it for less. It's a flat $60. You will have to check with each of those CCOs for the details of billing and how they're doing it. There could be variation, there could be differences.
I just have a curious question. Across the state, what is the most common language that requires interpretive services?
You know that, Edna?
I know Spanish is the one of the, so there's Spanish, Russian. I'll be happy to share the whole list, but there are some 14 languages that OHSU did their research when they were doing Senate Bill 698, I believe, for requirements to have the prescription labeled in the language of the patient. They came up with 14 most common languages here in Oregon. I can find that list and share with you. I know it kind of changed sometimes, but we know Spanish is very common.
It would be interesting, not necessarily something you've got to jump right towards. It's just looking at the population overall, that would be our guess. And a lot of our interpretive services currently are being used for Spanish speaking. I have a question. We're confused on the designation of quote qualified and quote certified interpreter. Can you please clarify? And is the reimbursement the same?
It is the same, I can say, but some providers, they give more, a little bit more for certified healthcare interpreters. So a little bit behind that. There were 7 languages, or there are still 7 languages that are certifiable here in Oregon. To be certified, you become qualified first for 4 years. In order to renew your credentials, you have to renew as a certified, only for 7 languages. And then there was a big issues and a complaint that is not, it is a barrier, especially if you are qualified 4 years, you're doing a perfect job. My language cannot be certifiable, it's only qualified. So other people complained about that. And then, so that has changed. You don't have to be certified unless you want to, it's optional. For those 7 languages, only simply because there is a testing center for that. People have to take a test, they have to study, take a test, and then sometimes they don't pass, especially for Arabic, where there are a number of dialects. They have to pay like $400 and then miss it and then do it again. So they give up. So it was expensive, it was time consuming, and they were not paying more. I know some organizations that they were not paying them more because it's a qualified and certified, they're in the same level. If I'm a qualified, I'm at the top of my language. So why do I get paid less? So really, it's just because someone goes through the testing and becomes certified. it's a choice. Whether you have master's and then you want to go PhD, good for now. So they don't have to be certified. You can work with a qualified, and they do high level quality of the same as the qualified, as the certified. It's optional. You can pay more, but not everyone does that.
One question that has been posed prior to today is because of the pretty hardy requirements for certification in terms of the number of hours and the expense, are there resources available for reimbursement for staff training to become certified?
So OHA provides free training, and if the free training is not available, they can do at least at a lower cost. So far, OHA has been providing trainings for free. There's one that's going to happen in Eastern Oregon, another one will happen in metro area, and probably Central Oregon already has been done. So it is providing those training for free at this point, giving scholarship through community-based organization, CBOs, where they know the population, they know what language is needed there, and then the grant will go through that. For staff who are bilingual and fluent, proficient in the language of the patient, if it's a provider, and David can help me, it's in the law. If the provider is proficient in the language of the patient, there are steps they can do it, so they don't have to go through taking a 60-hour training. They can go through the licensing board and show those that they are proficient in the. That's for providers. If there are staff in the house, again, make sure they take the training so their names will be on the registry and they have the registry number. Right, David?
Okay. Thank you very much. We have a follow-up question. We haven't found any information on free trainings for certification. And do you have a website link for those? I'm sorry, you're muted, Edna. Sorry.
Sorry. I sent a link to the registry, to OHA webpage for HCI, Healthcare Interpreters webpage. It does have different titles. So there is one for trainings that are approved by OHA. We don't do the training. OHA does not provide the free training. We provide grants to the CBOs, community-based organization, to provide the training. So that is training for credential, to be qualified or certified. To be certified, OHA does not pay for certification. That is individual, or if the organization wants that person to be certified, then that's a different level. We don't provide that. We provide the grants for the 60-hour training.
Thank you. Thank you for that clarification. There's another question. The House bill states that if you can't access the certified or qualified interpreter, you can use a bilingual staff member to interpret if you prove that you try to access the service. Is this only the urgent cases, or can this apply to any appointment in order not to cancel when the interpreter cancels the last minute?
That is, so you have to work with qualified or certified healthcare interpreters. If it's urgent, if there is an urgent emergency situation, and you try to find healthcare interpreters who is trained, qualified or certified from the registry, you could not find it, then you can work with someone else. Document the process that, yes, you went through the steps and you could not find a qualified or certified healthcare interpreters available on the registry. The law does not say stop providing care.
Wonderful. Thank you very, very much. And somebody was nice enough to post the different languages that are available throughout the state.
Okay.
And I'm hoping I will be able to work with our membership and get that link out so that there's a little bit more reference to specific trainings in specific areas, because I know that there's a lot of interest out there. It's an open question opportunity here. I don't see anybody with an open question that has yet to be answered. Does anybody have something? And please feel free to unmute and ask if that is your preference at this point. Questions for our esteemed panelists. So let me just ask, in terms of the optometrists located across the state, Have you had, is there one profession or another that seems to be using interpretive services more than another? For instance, medical offices, or are you tracking it by profession?
Maybe a question for me. I haven't broken anything down yet by profession, so that's something I'm interested in, but I haven't done.
Okay. Are services requested directly from OHA? I'm not sure I understand that question. Are services requested directly from OHA? So in other words, if you would like, I think that link will help provide some guidance there. In case you, for an interpreter, yes. They can go straight to OHA to find an interpreter for their services.
Yeah, you
Yeah.
can go direct to HA, their website, the web page or website there, type the language, look at the county, you can choose the county where you are and where you can get an interpreter by the language. And it also shows the availability. So if you can look at the person when they put their availability there. Some of those, most of them put their phone number or email address.
How is it determined that a patient needs an interpreter? Is it an official request by the patient, or is it just a clear understanding that there's not a proper communication going on over the course of the appointment?
Okay. So when I go to my provider, some places they have what they call the iSpeak card, where OHA have them. So patient will know I can use this card for the language that I need in an interpreter. I know some providers as well, when they send their bill, they put a language, they're like a number of languages on the back side where you can look. But yeah, it has to be between a provider and a patient to know, do you need an interpreter? I'm not answering clearly that one. I don't know.
Well, I'm sure that some of it is subjective, and certainly you're going to know whether or not you can or cannot communicate properly with the patient if you're not getting the replies that you need through eye charts and whatnot. But if I can move on, Clarissa says she still doesn't understand completely. Do we still need an interpreter if we have bilingual staff who can speak with the patient?
Yes, make your staff take the training, or I can just say in short, are they on the registry? Are your staff on OHA's central registry, Healthcare Interpreter Central Registry? If they are not there, then we are working with the interpreter who is not, and that is not acceptable, if I say that. But yeah, just if you have them and they're already in-house, make them take the training, they can submit the application, we process them very quickly, then they have the registry number. In case anything, to me, this is how I feel like, if anything goes wrong with a patient and it's the language that was a problem, then you can say at least you work with an interpreter who is trained, because it can happen, interpreters who can interpret in the community very well, but when it comes to medical terminology without going through the training, until I took the training, I realized there's so much to learn. So without taking any risk, it's just good to take the training, be on the registry, you take care of what the requirements needed.
That makes total sense. Thank you very much. Any other questions from the field? So if
I noticed there was one up there that I don't think we had hit yet, so I just wanted to call attention to it. And it was a question about if somebody from an optometrist's office gets onto the registry, do they have to be available to other providers in the area? And I think the answer is no. I mean, the interpreter decides what interpreting appointments they take. And so someone who's a staff person in your office who is on the registry could only be available for appointments at your particular office. That's totally fine.
Thank you for picking up on that one. I'm trying to scroll through these as fast as I can here. And Janelle is asking, so if you want to bill for interpreter services, well, let me just see here. That one just got axed out. So if you want to bill for interpreter services, you have to be certified or qualified. But if you simply need to translate and do not want to bill your staff, can you do it?
translate is different from the interpretation, and it's at the minimum level where healthcare interpreters can do the translation. So I'm not sure if you're referring to interpretation or translation.
Oh, that's a great clarification there. And I think that you may have helped considerably with that. Janelle, are you okay with that? Do you still have some questions? All right, so that one appears to be okay. I see that I have a couple more new messages.
Oh, I
She
think
said she's
can I
okay.
repeat the answer? I don't know.
Can you please repeat the answer one more time? Thank you.
So there is a difference between translation and interpretation. Healthcare interpreters can do the minimum site translation, not to go into details, but very brief do site translation, but not the translation, not the interpretation. They do the interpretation, not the site translation in the big documents, very minimum translation. So those are two different things.
Thank you.
Distinction that I would call out here, based on the question itself about, reimbursement versus providing interpreting services. And just as a reminder, House Bill 2359 doesn't really have anything to do with reimbursement. It's about the services and supports that you need to provide to a patient who has limited English proficiency. So when you have that person in front of you, you need to be working with someone who's on the registry, either a qualified or a certified person who's on the registry. And then separate from that, as Nathan, I think, was going to follow up on, but it seems like if they're not on the registry, then it sounds like they wouldn't be billable. And so your decision whether you're going to bill or not doesn't really impact on whether you need to be working with interpreters from the registry. I just wanted to make sure that part was clear.
Well, thank you for that. Is the translation of documents covered, and can we bill for these?
I think maybe Nathan will say that, but yes, that part of simple translation should be part of interpretation.
So for the translation of documents that are necessary and have to be completed and stored on record with our offices, they can bill for those services, document translation.
So at least for the Open Card, the program, it's tied to one patient visit. If there was activities, on a different day, but it was towards wrapping up that activity or sending off for document interpretation, maybe preparing for or after, that is all just going to be billed with the one appointment when the patient was there. It wouldn't be separately billable. I don't know how common that is, and maybe that's something that we should take a look at, but as it currently states, you bill for one visit. And work that's done towards that visit when the patient wasn't present is all wrapped up in that one payment.
Fantastic.
I just want to add in, since insisted for this, that part of translation, we call it site translation, is really minimum translation, like whether it's a name, but not big documents. So that's different.
And what about educational materials? Are there reimbursement rates for taking materials that are educational in nature and having them available in different languages?
Again, if the visit where the education was delivered, right, the counseling about vaccination, well, your ophthalmologist, so it'd be different. It'd be about diabetes and managing your vision there. I don't know what it would be. That appointment with the patient would be eligible for reimbursement, but all of the preparation ahead of that or following would be wrapped up in that one payment. So,
okay.
So not separately billable.
So we are about 8 minutes away from conclusion. Wondering if there's anybody out there that has another burning question. We want to take advantage of your level of expertise and flexibility here while you're here. Are there other states that currently have a program, or are there many states that require certified interpreters for Medicaid-related services that you're aware of?
David or Edna, do you guys know?
David might help on this one. Yes, we have, we did some research or study to look at what other organizations, other states are doing. And like Washington State, they also have their own way of doing it. David, do you want to talk about it? Yes, they are required some places.
Yeah, so I mean, federal requirements talk about the need for interpreting, but they don't get specific about what the qualifications are. And a handful of states have detailed that out further. And I think there are more sort of coming onto that list. But as of right now, Oregon and just a few other states have specific requirements around interpreting qualifications for healthcare.
Thank you. Got a new question. Do the certified or qualified interpreters send a bill to the physician, or do they expect payment at time of their service? Again, if the patient no-shows, is the physician still expected to pay the interpreter?
I'll just answer part of that. Yes, they need to still be paid, and then I'll let Nathan talk about the payments.
So I know the details of how we pay the physician's office, but I'm sorry, I don't know the details of how the physicians typically pay the interpreter service or the independent interpreter. So I'm out of my depth on that one.
I guess we can do some follow-up and then send out a notification and a wrap-up from today's meeting. And hopefully, and I can maybe work with you and find that answer. Or should I work with Nathan?
Nathan.
Okay.
That's in the payment. What I know, I mean, I know there are CCO or other healthcare providers who are not directing just work direct with healthcare interpreters. They go through language service companies. And then language service companies, they know how much they are paying interpreters. Do interpreters like that way? They don't, because they feel the money goes to this other third party or the bridge, and then they get less. But that's how it's easier for other providers to let me work with a language service company. I need this interpreter, and then you get the interpreter through that middle person, and then they pay the interpreter that way.
Yeah, and I would just sort of build on that the relationship between the interpreter and the healthcare provider is usually either a direct one, some sort of an agreement or contract between the provider and the interpreter, or indirect if they're using like a language service company that then would schedule and pay. So OHA isn't really involved in sort of those policies and processes. And so I would look to your own sort of contracts and agreements about, no-show policies and payments and those types of things. And if you don't have them, or if you have questions or think that that's not how it should be, then I would be pushing back on those specific contract agreements.
Have a question. Do interpreters set their own rates?
I wish they can. I don't think they do.
Yeah, probably refer you back to what David said just now.
Okay. And let me see, do they have to be in person, or can we use over the phone?
You can use it, especially during COVID. Over the phone was more common, but the patients, they prefer to have the interpreter right there in person. So whichever it's going to work to be able to provide the care.
Gotcha. Okay. I don't see any other questions in chat. Oh, I have, let me see. Nope. Any other questions? And I just wanted, yes, Dr. Hefner.
Yeah, so I apologize. I had to step away and take another call, but if this came up or not. So to your point, Edna, about the preference of the in-person interpreters, we 100% see that in our clinical system. I'm at Pacific University. We see that in our clinical system that is indeed the preference, but we also have a fairly high no-show rate for which there's then a subsequent bill for the time that then gets passed over to Oregon Health Authority to be paid. I'm not really sure how feasible that is to continue that in the future, right? If the goal is to use the funds for as many patients as we can, and then we have to schedule an in-person interpreter, the patient doesn't show and the interpreter services bill us for that, which then gets passed across. Is that policy going to continue forward, that they'll be paid for a no-show?
So far as the way the law is, yes, right, Nathan?
Okay. And we don't have a dog in that fight. We just want to make sure that this program as it exists will be able to continue to serve as many patients as possible. And we certainly don't want to jeopardize it in any way, shape, or form by, there's not a lot we can do. If the patient doesn't show, the patient doesn't show, but we see the bill comes across.
Absolutely. I hear you. Yeah.
And
Paying for no shows, it's, yeah.
Yeah, and I will say that depending on what the language is, we've seen a standard rate for Spanish interpreters, and then if it's Russian or Ukrainian interpreter, then the rate is different. There's a substantially different rate that's built for that from the interpreter service that we use, which is Linguava, because it's OHA approved. There's a significant difference in the amount that's billed out. So I don't know if it's paid at a flat rate for all interpreters from OHA, or it truly is allowed to be billed at a different rate.
That, as far as I know, languages of lesser diffusion where you hardly find, it's hard to find healthcare interpreters, their rate is a little bit more, and they're advocating for that even to increase for languages like MAM, where there's a dialect, it's not Spanish. So their rate is higher, but I don't know much about, the internal of how language service companies and the payment type.
Understood. Thank you.
Yeah, and Bill, I hear you that your expenses are probably do vary by language. I can speak for the fee-for-service or open card program. When the state is the payer for the Oregon Health Plan, the payment's going to be the same. It is an issue that we're looking at, but the current state is that there is no higher reimbursement, even though your expenses are going to be higher with some languages. And check with your CCO. It is possible that they are making some rate differences, but that would be up to each of the CCOs that you're working with.
Yeah. Thank you very much for your time and all your answers. We really do appreciate that.
Yes, and I have one more, if I may squeeze this in. Are we able to bill VSP and IMED for the T1013 code for the $60 reimbursement?
I need someone to help me out with VSP and IMED. I'm sorry.
There are insurance providers for eye care, and they are subcontracted through OHA. And oftentimes they will reimburse our doctors at a lesser rate than the rate that is approved by OHA. And that's not just for this code. There's another CPT code that we're dealing with where the providers who are subcontracted offer a lower reimbursement rate to our providers.
Okay, I think those are probably CCO subcontractors, and so the reimbursement and some of those details would be you would need to talk to the CCO about those details. I won't be able to speak to that.
Well, thank you. That is a big issue whereby there is a state-approved rate increase for a particular code, and then the VSPs or IMEDs of the world will not honor that rate, but rather a lesser rate for reimbursement. So we'll have to work on those issues at another time. But I've maxed out your time. And I want to thank you very, very much. This has been really, really helpful. And thank you, Edna, for serving as a resource moving forward, because I know that there's going to be some follow-up questions, and you've been just tremendous, all of you, for helping out with all of these issues. So thank you for taking the time. We will be posting the web link where you can access different information on training sites and qualification needs and that kind of thing. Is there anything that a piece of advice that you'd like to lend our listening audience at this point?
I just want to say thank you for having us. Thanks for the excellent facilitation. I'm hopeful that perhaps we've gotten the word out and we might see a little additional billing to the Open Card program. That would be great. We welcome it. But yeah, those are my parting thoughts.
Yes, I echoed Nathan. Yes, thank you for having us and trying to explain and see how it goes. I know at the beginning it's tough, but I think when we get to the place, everything will go smoothly and be able to just find healthcare interpreters, whether in-house or through language service company or direct. So if there's anything we can help, please reach out to us. Thank you.
Yeah,
Thank
and
you.
I echo that as well. Thanks everyone for their great questions and for paying attention to this important area.
Thank you again very, very much. We appreciate you. Take care.
Thank you.
Bye-bye.
Bye.
You know.
Bye.
Bye.